Here we'll talk about golf hole ureter. So what happens in case of TB of kidney? If you do the cystoscopy and see the ureteric orifice through the cystoscope, you can see this golf hole ureter. That means the ureter in the TB kidney appears like a golf hole, right? So if we see here, suppose this is the bladder and this is the two ureteric openings into the bladder, right? And now you are introducing cystoscope into the bladder, and now you will view this ureteric orifice through the cystoscope. It will appear something like golf like in case of TB of kidney. So this is the cystoscopic appearance of the ureteric orifice in case of TB kidney. It is rounded and the golf hole type. So normally how it will be like split like oblique. But in case of TB of kidney, it will be rounded and golf hole type. So what happens in the cystoscopy? In case of TB of kidney, there will be multiple tubercles and there will be bladder spasm and also edema of the ureteric orifice. So that will appear like this golf hole type. Eventually it will cause this golf hole ureter and then the scarring, ulceration, bleeding and the stone formation. So in case of TB, what happens? There will be scarring and the retraction, right? So if you see the picture, in the picture you can clearly see the ureteric orifice. If you are viewing through the cystoscope, it is looking like the golf hole in case of TB of kidney. Why? It is because of multiple tubercles and there will be edema of the ureteric orifice, and also on the top of it there will be scarring and the retraction formation in case of TB. So that's why you can see this golf hole type of ureteric orifice in case of TB of kidney. So the main points you have to remember is this golf hole ureter is a cystoscopic finding which is seen in case of TB of kidney. Why does this occur? It is because of multiple tubercles in case of TB, which causes this bladder spasm and edema of the ureteric orifice, which eventually causes scarring and the retraction, which will lead to the formation of golf hole type or the rounded ureteric opening. So that is about it. Bye.